Hello everyone, my name is Anna Adelstein and today I'm going to talk to you about postmenopausal hormone replacement therapy for treating chronic illness. So what is hormone replacement therapy, or HRT? Hormone replacement therapy is used to assuage some of the uncomfortable symptoms of menopause, like hot flashes, night sweats, and others. In addition to suffering from these uncomfortable symptoms, women post-menopause have an increased likelihood of being diagnosed with certain chronic illnesses as a result of a decrease in estrogen in their bodies. These symptoms include cardiovascular disease, whose increased likelihood can be attributed to a decrease in cardioprotective estrogen, osteoporosis, as a woman post-menopause is 25% more likely to experience significant bone loss, and a decrease of 2% bone density per year in the 5 years after menopause, and colorectal cancer. To combat these concerns, hormone replacement therapy became a widely used method. Research on women receiving HRT showed that there was a 9% decrease in incidence of cardiovascular disease. There were trends that indicated an increase in bone density, and there was a 20% decrease in incidence of colon cancer, all of these associated with hormone replacement therapy treatments. By the 90s, over 40% of postmenopausal women were taking HRT. In this graph, showing the number of prescriptions of hormone therapy in the US per year, you can see the steady increase in the 1990s. But you might also notice a steep drop-off after 2002. This is because of a 2002 report by the Women's Health Initiative warning of the adverse effects of postmenopausal hormone therapy. The results of the WHI study showed that women taking hormone therapy had an increased risk of breast cancer, coronary heart disease, stroke, venous thromboembolism, endometrial cancer, and other conditions. The WHI, along with the United States Preventative Services Task Force, ruled that the risks of postmenopausal hormone therapy outweighed its benefits, leading to its reversal. HRT prescription rates took a drastic decrease, but critics would not blindly go along with the WHI report and took it upon themselves to further investigate this medical reversal. They found that the Women's Health Initiative failed to specify which hormone replacement therapies held increased risks over others, and instead wrote off all methods of hormone replacement treatment, though it was found that some had less risk than others. Critics also didn't trust the initiative's sample size, which included demographics that were outside the scope of normal treatment groups. If you see here, the study included women above the age of 70 and women who were over 20 years post-menopause, who already had a significantly greater risk of being diagnosed with the adverse conditions reported in the 2002 WHI statement. This led to further investigation into the timing hypothesis, which claims there's a window of opportunity for a woman after menopause to safely and effectively receive hormone therapy to offset the negative symptoms of menopause. Lastly, critics felt as though the Women's Health Initiative had blown their findings out of proportion and made it seem like related risks were absolute risks. Since the WHI report, much research has gone into the legitimacy of their findings, and the way hormone therapy treatment is administered has undergone reformations. Currently, doctors prescribe HRT to women with uncomfortable menopause symptoms, but do not prescribe it to prevent any chronic illnesses. Doctors are also careful to selectively cater the treatment to only the most optimal group, that being younger women closer to the onset of menopause, and only prescribe the treatments in small doses. This is due to present research that corroborates the timing hypothesis. Still, the American Association of Clinical Endocrinologists warns against the prescription of HRT to women with medical histories that put them on the high-risk bracket. Thank you for watching my presentation on the history and current state of hormone replacement therapy treatment for postmenopausal women.